Schools and public health officials are warning parents about the dangers of a so-called mom code for coronavirus. It was first spotted this week on Facebook posts in Utah. Parents were urging other parents to keep sick children at home if they had COVID-19 symptoms and to not have them tested for the virus.
More disturbing, they were doing it to avoid quarantines that might delay school reopenings or even the cancellation of student sports events. Joining us now is education and parenting expert Dr. Karen Arounian. Good morning.
Good morning.
So this so-called COVID mom code, it began on Facebook. What's your reaction to some of those parents who claim that getting their kid tested is selfish and it leads to mass hysteria and possibly to school shutdowns?
Right. The only hysteria that we would have would be allowing children to come to school who were not tested, who were sick, that would possibly infect our community at school and forward into our broader community. So what we really need to do is show our community and our schools and our children in our homes that the proper wellness checks, the testing, the tracing, and leading to potentially quarantine or isolation is necessary if we want to move back into school and reopen safely.
I suspect the protocols are different from district to district, but in general, if you have a student who's going into a classroom or is involved in hybrid learning and a teacher or a school nurse suspects that child is sick, what's supposed to happen?
Yes, Frank, what they should do, of course, is take that child out of the classroom, and schools are supposed to be set up now and have a quarantine area within the school. That child's parents would be notified. The child would then go for testing, overseen in their community at a health facility, and thereafter they should stay out of school until they know for sure that they are 100% clean bill of health and have a negative COVID test. So they must await the results and they cannot be on school property.
And these parents in Utah are the ones who participated in these mom code posts, and they also were opposed to any sort of contact tracing for students. So what's the standard when it comes to COVID-19 infection and schools conducting contact tracing?
Yes, well, there were new CDC guidelines that came out recently that more or less, if your child has been exposed to another child or an adult within the community of school, they would need to be put into they would go into a situation of isolating them by going into a quarantine if they had 15 minutes of exposure and went for testing, and that testing let them know that indeed they had the COVID-19 infection. So that's what we really need to do, is to look at each situation and ascertain if they've had 15 minutes of exposure. See, this exposure, it accrues, whereas before they would say 15 minutes with that particular person who has been identified in having the COVID-19 virus. Whereas now it can be 5 minutes in one location, 5 minutes in another location, perhaps in the school, and another 5 minutes. And that would lead then to having this child go for testing, and if indeed they had, they would also need to quarantine.
Presumably at some point we'll have a vaccine, and students, I suspect, will have to get them to get back into school. Are you concerned about how that's going to roll out?
I believe that once we have a vaccine, people are going to want this vaccine. It will more or less be their admission ticket back into schools, back into work, back into community. So we are all going to see that this vaccine is safe, and it's going to give us what we had before back, which is going to be this accountability, this transparency, and we'll be able to go into our environments knowing that we're protected.
Doctor, thank you so much for your advice this morning. Again, Dr. Karen Arounian, an education and parenting expert. For more information, you can check out her website and follow her on Twitter, Instagram, and YouTube.